Seeing no one else, is there a motion by Ms. Berner, second by Ms. Aguirre-Curry? Is there opposition to the bill? Reminder, we have 2 witnesses testify.
Yes, Chair Wood, we had a request for you. If we could have myself from CNA, Black Lives Matter California, and and Healthcare for All of us split our time for 2 minutes, we would very much appreciate it if it's okay with you.
We will honor that in the future. I'd appreciate it if you'd let us know you're bringing through witnesses. Thank you.
Yes.
So 2 minutes each.
Thank you, Chair Wood and committee members. I'm Carmen Comsti, Lead Regulatory Policy Specialist with the California Nurses Association, proudly representing over 100,000 registered nurses throughout the state. CNA has for decades championed guaranteed healthcare for all through a single-payer system, and we recognize Senator Wiener's continued support for CalCare. However, we strongly oppose SB770 because this bill would unnecessarily delay California from achieving this goal. As a women of color-led union, CNA intimately knows that delays in ending the profit motive in healthcare will cost us the lives and the health of Black, Brown, and other marginalized and income-insecure communities. This bill unnecessarily would task a new informal work group to duplicate the work of the Healthy California for All Commission, which I proudly served on with Dr. Wood. For 2.5 years, the commission analyzed the issues of unified financing, including on federal waivers, and we spent millions of taxpayer dollars in the process. The final commission report provides everything you need to take decisive legislative action on guaranteed health care for all. Concerningly, however, this bill would restructure our healthcare system through an unaccountable work group and futile waiver discussions with the federal government. Federal waiver law is clear. California must first enact a policy bill, like single payer, before federal HHS can lawfully sit at the negotiating table. SB 770 is not a single payer bill, it is a unified financing bill. The commission was clear that unified financing could mean a multi-payer system with a role for health insurance, where insurers and other profit-driven middlemen continue to squeeze wealth from our health. Continued delays is unacceptable to the nurses of CNA. We respectfully urge a no vote.
I do want to apologize. I did not realize that my staff just informed me of something here, so my apologies. So we have 2 more minutes each. So go ahead.
Hi, I'm Sheila Bates. I'm the policy lead with Black Lives Matter California, a coalition of chapters across the state, which is a part of our larger organization, Black Lives Matter Grassroots. We work to end state-sanctioned violence against Black people in all of its forms: physical, economic, social, and political. Black Lives Matter California supports single-payer healthcare, a necessary policy that is long overdue that can transform our state and literally save lives. Black Lives Matter believes in tearing down systems of harm while building systems of care. That absolutely includes single-payer healthcare. Accessible, taxpayer-funded, comprehensive, culturally appropriate healthcare, as laid out in CalCare, is a form of public safety. Due to our positioning, we are in strong opposition of SB 770, a bill that could not only derail California's single-payer healthcare efforts, but single-payer healthcare efforts throughout the country. Black Lives Matter California, its leadership, membership, and the larger Black community have experienced and or seen the very real, devastating, and deadly effects of medical apartheid. This is not only clear through anecdotal evidence, as demonstrated in qualitative data, which are our stories, but also in quantitative data that tells us that Black women are 3 to 5 times more likely to die in childbirth than white women, or that Black infants are 2.3 times more likely to die in their first year than white infants, and several other health disparities clearly documented in the data as a result of social determinants of health. We know that a true single-payer healthcare bill, such as CalCare, is meaningful redress to medical apartheid that continues to steal lives and negatively impact the health of Black Californians. We see SB 770 as a barrier to real solutions. We don't need more studies. The data is there. We don't need more working groups as proposed by SB 770. We need meaningful action now. We must stop SB 770 so we can advance and pass a true single-payer healthcare bill. We urge the members of the Assembly Health Committee to speak up and advocate for residents who are counting on their vote so that we can get to the meaningful, life-saving, and life-affirming work of passing CalCare, a comprehensive single-payer healthcare bill. We can no longer wait. Too many lives have been impacted and continue to hang in the balance.
Good evening, Assembly members. My name is Cheng-Sim. I'm an immigrant and a 2-time cancer survivor. Having cancer opened my eyes to the gross inequities of the health insurance system, and that has turned me into a single-payer activist since 2016. Today, I represent HealthCareForUs and Asian Pacific Islanders for CalCare to say we strongly oppose SB770 and call on this committee to vote it down. I'm not a lobbyist, a consultant, or even a paid staffer at a nonprofit or union. Single-payer activists like me are unpaid volunteers. We are not interested in political games. We have no agenda other than to have California enact single-payer. Please hear us when we say SB 770 is not a single-payer bill and is in fact detrimental to the real single-payer bill, CalCare. Everything about SB 770 is disingenuous. Its sponsor has claimed that the bill is complementary to single-payer when the bill actually proposes more time wasting on waiver discussions that are not even specific to single-payer. The bill's timetable gives cover to legislators to say they cannot pass CalCare in 2024 because they have to wait for SB 770 mandated reports to come in next summer or possibly later. But most disturbingly, with its unified financing language, SB 770, if passed, will set the stage for California to codify a multi-payer system where insurance company intermediaries, HMOs and ACOs, will administer healthcare using public funds. This is absolutely antithetical to single payer and defeats the entire purpose of healthcare reform. I call on you, Assembly members, to do what's right, morally, financially, and yes, politically. You have the power today, right now, to save lives and money. Vote no on SB 770, then act to pass CalCare. Thank you.
Okay, thank you. I am going to give another witness an opportunity to speak in opposition. We have 3 witnesses for, I'm sorry, no, this is opposition. This is opposition. So you had 3 witnesses representing the same group, correct? Yes.
No.
Well, she said,
no.
I'm here to support CalCare. You're here to support CalCare. That's what I thought I heard from the third
No,
witnesses.
I'm here to on behalf of the California Nurses Association.
Okay, regardless, I'm going to give another witness 2 minutes, and then I'm going to give Mr. Weiner, Senator Weiner, an additional 2 minutes if he would like. So, please go ahead.
For opposition.
For opposition, correct.
Thank you. I appreciate the accommodation. Nick Luizos on behalf of the California Association of Health Plans. We are opposed, and I do appreciate the accommodation since our opposition is coming at this bill from a completely different angle. We oppose the bill because it requires the state to petition the federal government for a waiver. It's authority that California doesn't require or need to basically change the system in a way that Californians don't want. Basically, SB 770 is the first step from our perspective toward a government-run healthcare system, which would not only eliminate Medicare as we know it, but the Medi-Cal program as well. It would prohibit all private coverage and force every Californian into an untested new health system with no ability to opt out. Single payer in California has been analyzed in the past. It's going to cost over $500 billion a year, requiring large tax increases on individuals, employers, and small businesses. And it doesn't do anything to address the workforce shortages that we've seen in healthcare, or it will do nothing to keep doctors and hospitals in the system. The bill also asks the legislature to endorse the Healthy California for All Commission report, a long document, but one that doesn't answer fundamental policy questions. Committee members should ask themselves whether they are on board with that endorsement of this report, particularly if you haven't been briefed on its contents. California has made incredible progress in expanding access to affordable coverage since the passage of the Affordable Care Act. And indeed, the budget that was passed today includes significant investments in access to health care and lowering of enrollees' out-of-pocket costs. So we are making great strides in California. Studies continue to show that Californians are largely satisfied with the health care that they receive in California. and they do not support this transition to the healthcare system. So we're opposed for those reasons. And thank you again for your indulgence.
Thank